Hi there. This is Dr. John Norton Jr. with some medical information on prescription on drug on medicine uh, and important information actually. Frequently, I get patient questions over the years and even currently about what is the difference between non-prescription drugs and which are generic drugs and pharmaceutical, which is doctor-prescribed pharmaceutical drugs. And what is it? So, what is the difference in cost, and what is the difference in effectiveness, and how does it affect my treatment of medical condition? Uh, Let me detail a little bit here in this segment and try to bring some clarity to it for patients who have this definite question in their mind. Pharmaceutical drugs, let's start off with pharmaceutical drugs are doctor prescribed and are very effective in treating medical condition. And they're generally used for more intense medical conditions. I'll give you some example of like cancer or kidney disease, uh, renal disease, etc. These are which is renal kidney failure. That's what I'm talking about. Pharmaceutical drugs are most commonly used because of their higher strength and higher efficiency, higher effectiveness, and overall general capability to provide treatment and also cure capability for modern day diseases. So how does this affect the difference? They're also very expensive, and generally they're also covered by most health insurances, including state and federal health care systems, such as Medicare and Medicaid, and and state-sponsored medical insurances like neighborhood health plan, etc. Whereas generic drugs, let me explain a little bit about what generic drugs are, which is non-pharmaceutical drugs. They're frequently used to treat something like a common cold. For instance, like Advil or Aleve, to use to treat as for treatment for arthritis pain, where you don't have to use a high-strength pharmaceutical drug for treatment. Uh, and for common cold, I mentioned, you would be using uh, something that would help you with your nasal condition, for instance. And and also you could use bare aspirin, otherwise sometimes known as acetaminophen in doctor terms. But you can. So the difference is in the medical condition that you have that is being treated and by a competent medical professional. And in the case of a non-life-threatening condition such as a common cold, or in case of treating back pain or arthritis, where you could use non-pharmaceutical generic drugs, would still be very effective but do not require heavy pharmaceutical invasive medical use. So I show you a little bit different, and also not generic drugs which are non-pharmaceutical are generally not covered under any state federal health insurance, and private insurers tend to not cover those kind of drugs. So that would be out-of-pocket expense to purchase them at your local pharmacy. So I hope this brings clarity to some patients that have these questions. Thank you very much.